Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. This is a great place to be if you desire to take charge of your health so that you can live fully while enjoying doing what you love. And today I'm here with a special guest, Dr. Tristan Ezeoke, and he's the founder and doctor of physical therapy of Injury to Victory. His interest in a holistic approach for knee and joint pain started after he had multiple traumatic knee injuries, where he battled with knee pain and instability for years. And so he's coming from a personal angle, and so he's going to tell us a little bit more about how to handle knee pain and how to prevent it as well. So welcome, Dr. Ezeoke.
Thank you for having me. I appreciate the introduction.
No problem. It's nice to have you. So you're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land. And we offer stress-free health care with direct access to the doctor so our patients can get the care they need without the inconveniences and the delay that come with the traditional healthcare system. You can learn more about our services on our website, www.intouchprimarycare.com. And if you haven't already, hit that subscribe button. That helps us get the word out so more people can get this useful information. And as usual, always follow up with your own doctor for specific recommendations for your treatment. All right, let's get into it. So, Dr. Ezeoke, what would you like to share about yourself personally and or professionally?
Yeah, so I think one of the things that is most valuable for people that I work with is similar to what you mentioned, that a lot of my interest was piqued from what I went through personally in terms of my own knee and joint issues. And so a lot of my focus is on that because I saw and experienced what I went through with traditional physical therapy, with medical industry as a whole, sort of almost neglecting the desires that I had and where I wanted to be, and also neglecting some of the things that are very important for knee and joint health as a whole. So really, it's just knowing that this is piqued by my own personal experience. So yeah.
Yeah. And that's great. That's always helpful when you can share your own experience, and so we know it works. So you specialize in helping people become strong and healthy without pain. Can you share a little bit more about that journey that you had that brought you to this path?
Yeah, so I first started out just coaching people, training people in general. And because of the population of individuals that I was working with, I realized that they had a lot of knee issues, back issues were the most common things that I saw. And so even as a trainer, and this was about a decade or so ago, then I had realized that the things that I was doing, and because we were focusing on the general health, they would come back to me and they would say things like, hey, I used to have knee pain for a while, or I used to have back pain for a while, and now I don't have it anymore, even after doing injections and things like that. So that's what led to me then pursuing my doctorate in physical therapy, or that was a lot of what sort of inspired me to really pursue that. And so getting my doctorate helped to elevate my knowledge of joint health, of joint pain, of more knowledge around the knees, since I would gravitate more towards those topics. And that flowed so nicely with the issues that I had dealt with, because I just had a general interest in knee pain in general for myself, even prior to me working with people. And so it just flowed naturally to where more of my specialization and more of my interest is in, with helping people have happy, healthy knees, happy, healthy joints, and a happy, healthy body in general, so that they're not limited by anything. So.
Yeah. All right, great. Thanks for sharing that. Okay, so let's talk about prevention, because, while people do have knee pain, there are people that don't yet have knee pain, but maybe doing things that can make them at risk for knee pain. So what are some common mistakes that you've seen people make that can result in knee injury, and how can they avoid those things?
Yes, there are a couple of things that I've seen. The first thing is typically doing too much too fast whenever they're not ready for it. So, for instance, there will be someone that will have an issue after playing pickleball or tennis or running or something like that. And a lot of the reason why they will have knee issues is because their bodies just weren't prepared for the amount of stress that they went through. And so one of the things that's important to note is that when your body goes through a high amount of stress, whenever it's not ready for it, that's typically when an injury will occur. And in the knees, that's a lot of what I've seen. The second component of that are people who just with age have things like bone-on-bone arthritis and things like that. And one of the easiest ways to prevent both of the issues on one side, which is doing too much too fast, and on the other side, maybe not doing enough, which leads to breakdown of the joints, is being able to do things like deep squats on a regular basis, deep lunges on a regular basis, movements that help to promote healthy stress within the joint so that the body is ready for more, so that it breaks down and rebuilds up in a healthy manner to prevent both of those issues from occurring. So those are some of the most common things that I tell people in terms of preventing knee pain is doing deep squats on a regular basis, doing deep lunges on a regular basis. That's a very easy way to promote the health of the knee joint to prevent injury and pain.
Okay, thanks for sharing that. And the funny thing is we do these things when we're kids, right? And then for whatever
Exactly. Yeah.
we get to an age where we just decide that we're not doing those things anymore. But if we just kept doing it will help us to continue to have healthy joints. So thanks for sharing that. Okay.
Yeah.
So people have knee pain and they may be watching this and wondering, okay, too late for me. I already have pain. What can I do now to reduce my pain and stabilize my knees? So can you give some practical tips?
Yeah, so there are three different categories that I'll typically split this up into. The first practical tip is that you should be working on the mobility of your hips, because the mobility of your hips influence what the knees are doing. So there's some people that will go online. For me, I post things on social media that will help to improve the mobility of the hips. So that's an easy way to start getting more joint health in the hips, which will influence the knees. The second thing is then doing things that strengthen the muscles that influence the knees. The knees don't have muscles that surround them like the hip joint. And so we don't work muscles that are around the knees. We work muscles that influence the knees that come from the hips. So if you're starting to do movements that are sort of strengthening the muscles that are at the front of the thigh, around the hips, like their glutes, even working on your core is actually important for the health of your knees. The third practical tip is start seeing how the way that you eat influences your knee issues. And that's because, for instance, I'll have clients who, especially during the summertime, will go on a trip, or they'll have somebody's birthday party, 50th birthday party, or somebody that I just talked to who had her daughter's 30th birthday party, and they have a blast and they're, quote unquote, dropping it low. And, there's a little bit of alcohol consumption, and there's a little bit of, maybe sugary food items that's incorporated with that. And all of a sudden, after the weekend, they'd be like, man, I don't know why I feel so stiff and swollen and this and that. And a lot of that is because what you ingest in your body has a significant impact on inflammation, on swelling, and on the health of your joints and the knees as a whole. So those three things, mobility, strength, and health, are the most common things that I'll communicate with people. So.
See, this is why I like you, because you touch on such an important aspect of health. And, that's one of the things. Please follow Dr. Ezeoke on social media. He posts a lot of great information, practical things you can start doing today for healthy joints. And I love that you talked about what you eat, because I'm all about that. Food is medicine, and it's so powerful. And the fact that what you eat can cause inflammation is a real thing. And sometimes we don't always connect the dots with how food can affect pain, like knee pain.
Yeah. Yeah.
And so the fact that you talked
Mhm.
about that, that's powerful. And other things you mentioned, mobility of the hips, that's so true. The joints around
Mhm.
the joint, the painful joint typically has a lot to do with that painful joint. And so if you can stabilize joints around the painful joints, it does
Mhm.
make a big difference because you
Mhm.
adjust how you move based on pain, and sometimes that causes
Mhm.
more problems. And then strengthening the muscles. So those are really,
Yeah.
really helpful tips, and truly appreciate those. Okay,
Yep.
so when would you say someone with knee pain should seek professional help? Maybe they should see a doctor or a physical therapist. When would they know that it's time they should stop home management?
So I say that the line is a little bit closer than what most people would think. It's when so like, let's say that you have a knee injury from, if you sat down or stood up and you tweaked your knee, typically a couple of days after, then you have a good idea of how your knee is doing. And if you just had a small tweak, it probably will just improve on its own because the body has natural healing mechanisms that allow for that to happen. So if you're the individual who now maybe it's a re-aggravation of something that's happened in the past, or maybe you've been having this for more than a week, maybe now it's affecting your day-to-day, maybe now it's affecting things that you personally value. Like I have a client who loves going hiking. And so for her, then it's more important for her to go to somebody sooner because she values hiking, even though she's able to sit down, stand up, walk around fine. So in those particular scenarios, whether it's something that you value or something that you can't do on a day-to-day, or something that's been going on and off or on for a long period of time, those are scenarios where you should seek out help from a professional.
Yes, absolutely. And I think what you said too, sometimes when you let things go, it gets worse. And
Yeah,
so
yeah,
it's so important that the sooner it gets addressed, the better. Because
the
once
better.
it's worse, it takes longer to recover. So
Exactly, yeah, yeah.
that's the other piece of it.
Mhm.
And I like that,
Mhm.
I'm a big fan of physical therapy in general because, well, my mom is a
Mhm.
physical therapist, so I saw her
Oh
do
yeah,
all kinds of things, growing up, and I saw how it helped
yeah.
people. So that helps. And then the second thing
Mhm.
is, it teaches people how to use their muscles properly so that they don't
Mhm.
re-injure. So there's one
Mhm.
aspect of, the initial treatment, which we reduce the pain, we resolve the pain, but there's
Mhm.
also, re-injury that can occur when areas of the body are weak. And I like that
Exactly.
physical therapy helps teach you how to strengthen those areas so that you don't re-injure. So,
Mhm.
that's why I really like it.
Yeah.
Okay, so we've come
Yeah.
towards the end here. Do you have anything else you'd like to share? Any advice or quotes that you want to leave our listeners with today?
Yeah. Yeah. So I don't necessarily have like a really a profound quote per se, but what I will leave people with in general, and this is probably the most valuable piece of advice from what I've seen working with people, is that you're more than just the pain you experience.
Mm.
And the reason why I say that is because a lot of times people that have knee issues or joint issues will be like, I just got to get rid of the pain. But if you zoom out and see how other joints affect each other, you zoom out, see how maybe the way you eat, you sitting all day at work, things like that can affect the health of your joints and the health of your knees. That will be the most valuable change in perspective that will affect the way you interact with other medical professionals, and that will affect the way that you go about healing your body. So
Yeah.
it's probably the
Okay.
most valuable thing.
Yeah, that's very powerful, actually. Thanks for sharing that because our bodies are all
Of course.
connected. Everything in our bodies are
Hmm.
connected. So what we
Yeah,
do to one part affects the other parts. So the sooner we
100%.
put that together, the better off we are.
Hmm.
Well, how can people find you?
So most common way is through Instagram. If you go on Instagram at Dr. Dr. period Tristan, Tristan, Ezeoke, Ezeoke. then that's the easiest way to find me, through website at injurytovictory.com. So just injurytovictory.com. And those are the most common ways to find me. Also on YouTube, Injury to Victory. And I also have TikTok. Some people find me through TikTok. There's a lot of people who are 45 plus that love TikTok. And so it's the same as my Instagram handle on TikTok. And those are probably the easiest ways to get in touch with me and to find me.
And where are you located? Where is your clinic located?
Yeah, so I'm located in Sugar Land, Texas. So it's right off of Highway 59 and Highway 6 is where my location is. So
Great. So for those in the area, you have a great physical therapist just down the street from us here. So please make your way over there if you need to. All right. So thank you for listening. This is Connecting the Dots with Dr. Ashaye. Remember to subscribe and share with someone that might need this. And if you're in the Houston area and you're seeking detailed, thorough care, come join our membership practice at In Touch Primary Care, and you can enroll on our website, www.intouchprimarycare.com. All right, until next time, have a great day. Bye. Thank you, Dr. Ezeoke.
thank you.